Hey guys, Russell Gunner here from Club Physio Plus. How you doing? Today we're going to talk about a really popular one we see a lot, especially in different times of year, what's called golfer's elbow. It's all along the medial side of your elbow. The reason we call it golfer's, tennis is going to be on the outside of the elbow, which we've talked about before, but golfer's elbow is all on the inside. The idea of it is usually most popular because of golfers, when they come down in the club, they come down in the ball, they hit the ground and offers a sudden vibration, and that may strain a muscle. Similar to tennis elbow, the inside part here, all the muscles that lift your wrist up, those are called flexors. Those flexors all come down and attach into the one spot in the elbow here, this little bump right here on the inside. And if you have it, you've had it, you know exactly, it's very sensitive right on the bump there. So what do we do for it and what can you do at home? Stay tuned. So what can we do when you come in to get treated? So there's several things we can do. Main thing is we got to figure out, make sure it is exactly medial epicondylitis or golfer's elbow as you know it. So several things we can do. We do a lot of hands-on work to try to loosen up all the flexor muscles through here. We can do that through massage or soft tissue release or some other techniques we can maybe do. We'll probably work through up to your biceps through here a bit too to try to loosen that up a bit. We do some laser possibly on it. That's the machines we use here. It's called the Med-X machine. We can do some laser on there to help break down some of the scar tissue. If you've had it for a long time chronically wise, the shock wave works fantastic. We'd shock wave around the area there. It may be a little uncomfortable to do, but I'll be honest with you, really, really effective when it comes to sort of chronic soft tissue injuries. But to be honest, I find that the shock wave really, really works well if it's been at least 6 to 8 weeks since you've had it. So it wouldn't really work great if you just got it yesterday and you just strained it, because we don't want to cause any more inflammation in the area. We'll also probably send you home with some stretches to work on, something that's going to help take the tension off the area so you can do stuff at home. One of the things we have to really make sure you do, though, is to help prevent it from getting worse. It's really tough to do. We don't want to rest from our activities if you're playing golf or tennis or whatever activities we're doing. That would help it for sure. We don't want to necessarily put it in a sling. That's one of the worst things you can do. But one of the best things to do is try to avoid lifting things with palm up. So if I'm going to use this weight as an example here and I got a bag or something, if I lift it like this, that hurts. That kind of pulls right there because I'm now using those muscles through here, the flexors. I'm going to grab that weight, grab it with palm down. That'll use the muscles on top here, takes the tension off here. So any simple things, you're grabbing your briefcase at home, the groceries or something, grab them with palm down. That shuts off the flexors and helps out your extensors there too. But for stretching, that's a simple stretch you can do. We've all done this before probably, I'm sure. Hold your arm out in front of you. Hands are going to be pulling up, and the other hand's going to help try to hold and pull it backwards. You're going to feel a good stretch through the bottom of your forearm here, through those flexor muscles. You're going to hold that for 20 seconds. All right. As you release it, sometimes you want to go back down. That'll get the top muscles now. Those are extensors there too. Just make sure you're using your hand to help it. Okay. Hold those for at least 20 seconds a couple times and do those a few times a day. As far as strengthening goes, you can do some strengthening exercises, but you got to be careful how you do it. I always like to train people to do what's called eccentrically. It means lowering the weight only. So don't be doing these things, which is up and down. What I tell people to do is usually bring your hand up, put your weight in it, and slowly, slowly, slowly lower that down. It's called eccentrically loading the muscle. We're trying to lengthen the muscle as we strengthen it. Back up. Slowly, 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 slowly come down. Okay? You don't want to do this way for a while until most of the pain is gone. Okay, so that's a quick little blurb about golfer's elbow. If you have any questions at all, you want to try some different things we use in the clinic here, give us a call. We'll see if we can fix it for you. It's obviously quite effective, some of the things we can do. But most importantly, see if you can take the pressure off it and hope that feels better. All right, we'll talk to you soon. Take care.